limited range of motion in my neck. It just felt tight all the time. Looking up was painful. Reaching out to the front was very painful. It would send like sharp pains down my arm, then and down into the side of my neck. It got to the point where it was just a chronic pain, you know, and it just starts wearing on you.
It's estimated that 50 to 70% of Americans will suffer from neck pain at some point in their lives. For most people, the pain will get better with conservative treatments. However, if you have persistent pain that radiates down your shoulders and arms, or the presence of significant weakness, numbness, or tingling in your arms, hands, or fingers, your doctor may recommend surgery. You may have headaches that radiate to the back of the head, or you may lose your balance. Neck pain could be keeping you awake at night and may interfere with your job and the activities you love. Many chronic neck pain conditions requiring surgery are due to degeneration of the cervical spine, also known as cervical spondylosis or cervical osteoarthritis. Changes in the disc can lead to other problems, such as narrowing of the spinal canal, more commonly known as stenosis. Cervical degeneration is most often caused by aging and wear and tear. Whiplash, most often from an automobile accident, is a frequent cause of injury-related cervical pain and can result in damage to the facet joints and discs in the neck. Spinal deformities, tumors, or other diseases can also play a role in cervical degeneration.
My husband and my son both ride as well. You know, it's something we do as a family, and you know, if I couldn't be a part of that, that would be a big change in my lifestyle, and I just wasn't ready to let that happen.
This video will help you understand more about your cervical spine, degenerative disc disease, and anterior cervical fusion surgery. This video is for educational purposes only and is not intended to be used to diagnose or recommend treatment for your neck condition. Only your surgeon can recommend cervical fusion as a treatment option. Any questions or concerns you have should be discussed with your surgeon. Let's take a closer look at how your spine works. Neck pain comes from the cervical region, which is comprised of the 7 vertebrae at the top of your spine. Each vertebra has a space called the spinal canal, which protects the spinal cord and the nerve roots. The nerve roots exit the spinal canal through the openings between the vertebrae on the side of the spine. In a healthy spine, the vertebrae are separated by discs that act as cushions and allow the spine to move smoothly. Over time, with wear and tear, the discs may lose their cushioning effect and the ability to move freely. This is called degenerative disc disease. As the disc collapses, the spine may lose its normal alignment. Bone spurs may form, which can grow into the spinal canal and pinch the cord or nerve roots. This is called spinal stenosis. A collapsed disc may also bulge or herniate through its outer layer. This may press on the nerve roots as they exit the spinal canal and cause pain, numbness, or tingling, or weakness in the arms, hands, and fingers. Discs do not have the ability to repair themselves, like some other tissues in the body. That's why degenerative disc disease often continues to progress as time goes by. If you're already considering surgery, you've probably already been through a host of non-surgical treatments, including pain medications, exercise programs, and physical therapy or chiropractic care. You may have worn a cervical collar to help limit neck motion and reduce nerve irritation. You might even have had injections to reduce inflammation and pain. If these have failed to relieve your symptoms, your surgeon may recommend cervical fusion surgery. The goals of anterior cervical fusion surgery are to reduce pain, relieve swelling, irritation and pinching of nerves, provide stabilization, and restore function. By stabilizing the cervical spine, you regain the ability to return to your daily life activities. Anterior cervical fusion surgery requires that your surgeon perform the procedure through an incision in the front of the neck. During the procedure, your surgeon will remove any bone spurs or portions of the vertebra that are pinching the nerves, and then remove the disc. Removing the disc is called a discectomy. A spacer is then inserted between the vertebrae in place of the removed disc, so they may fuse and form a solid union. If bone is used as a spacer, the graft is sometimes taken from your own bone, or your surgeon may choose to use bone from a bone bank. Synthetic bone graft or other man-made materials may also be used. This can occur in any combination. A plate may be attached with special screws to secure the vertebrae until the bone grafts have a chance to fuse together. The bone graft should set within the first 12 weeks after surgery, and in 6 months to a year, the fusion of the vertebrae should be complete. Although in some cases, fusion may take up to 18 months. Anterior cervical fusion surgery has been performed for more than 50 years, and repeated studies have demonstrated the effectiveness of the procedure. While unusual, complications can occur during and after surgery. Possible complications include, but are not limited to, continued pain, swelling, bleeding, loss of motion, delayed healing, non-union, and nerve damage. Although the surgery may be successful, some patients may still experience stiffness and pain.
I woke up, my arm felt better immediately. I could tell it was better. And, when I went home, I was bored to death because they wouldn't let me go back to work.
Before the surgery, your surgeon may ask you to do a number of things to help make the procedure go smoothly and to help your body heal. If you smoke cigarettes, you'll be expected to stop for a period before and after your surgery because smoking can interfere with a successful bone graft fusion. You'll be encouraged to eat healthy, well-balanced meals. And of course, you'll want to follow all of your doctor's instructions. After the surgery, you can expect to be in the hospital for several days. You will be encouraged to be up and around the first day after surgery, and you will receive assistance in becoming independent and caring for your personal hygiene. Because the bone graft takes a period of time to set, your doctor may ask that you wear a neck collar for a period of time. During this time, you will not be able to drive a car. After a sufficient rehabilitation period, your surgeon will tell you when it's safe to resume your normal activities. Patients are typically able to return to many of the activities they enjoy.
I'm not limited at all. So I ride. Unfortunately, I can still do all my home and housework. I lift the trays at work with no problem. I haven't even had any flare-ups, anything. I've been very, very pleased. Couldn't ask for anything more.
The decision to have surgery is sometimes difficult. This video is not intended to replace the experience and counsel of a physician. Rather, it is meant to educate and empower you as a patient. Your surgeon will be happy to answer any questions you might have. You may also call your surgeon's office and arrange to speak with someone who has had cervical surgery and can share that experience with you. It's just another way you can learn about the procedure and what to expect.
It was the only option I had to continue to live the quality of life I like to live. We have 72 acres and lots of trails to ride on. So we're gonna take the horses up. We love it.